Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock, a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, digital flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 45-year-old male presents with unilateral scrotal pain, fever, and dysuria for the past 48 hours. The physical exam reveals tenderness along the epididymis, and the patient reports pain relief with elevation of the scrotum. Friend sign. Which of the following is this most likely diagnosis? Is it A, testicular torsion, B, epididymytis, C, varicose, or D, hernia? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, which of the following is the most likely diagnosis? All right, so I always tell y'all, if they're asking for a diagnosis, you need to run it back and look at the assessment findings. So also paying attention when we're looking at assessment findings in that HPI is their age, their gender, and their ethnicity, right? But this is a 45-year-old male. His chief complaint is unilateral scrotal pain. He has fever, dysuria for the past 48 hours. On physical exam, there is tenderness along the epididymis, but there's also a positive friend sign, right? Because he reports pain relief with the elevation of the scrotum, right? So with this, we have what? And your best answer is B, epididymytis. One, he has tenderness along the epididymis, but also the Prin sign is positive. Remember, I tell you, when we are trying to determine and differentiate between epididymytis versus testicular torsion, Prin sign will be positive with epididymytis. And Brittany's brilliance, I tell y'all, think about it because epididymytis has the P in it. So P for positive, positive Prin sign, whereas testicular torsion has the N in it and it's for negative. Okay. So that's how I always, that's my Brittany's brilliance to remember that. So hopefully y'all found that helpful. All right. Question number two. Which of the following is the first line treatment for epididymytis in a sexually active male under 35 years of age who is diagnosed with chlamydia infection? Is it A, ceftriaxone 250 milligrams IM, B, doxy 100 milligrams twice daily for 10 days, C, ibuprofen 400 milligrams every 4 to 6 hours, or D, prednisone 10 milligrams daily for 7 days? Take a moment and tell me what you got. All right, so stem of the question here. I always tell you about the stem, but in this case, the stem is the question is the stem. So which of the following is the first line treatment for somebody that is diagnosed with epididymitis with an STI, right? Specifically, chlamydia as the STI. All right. And so this is also something that I teach you guys, that when we are talking about epididymitis and they're telling you this person is 35 years of age or younger, you want to consider that it may be potentially secondary to an STI, right? Here, not only have they provided you with the diagnosis of epididymitis, but they have provided you with a confirmed diagnosis of the STI of chlamydia, right? So that's telling you twofold on how to manage, what to consider to be able to treat it, so to speak. So in this scenario, your best answer is doxy, right? Because doxy will cover the epididymitis as well as chlamydia. Now, if they were to say like the STI was gonorrhea, we would have went with A, ceftriaxone, right? But again, the best answer here is doxy, 100 milligrams twice daily for 10 days. All right, and lastly, question number 3. A 19-year-old male presents with sudden severe scrotal pain, nausea, and vomiting that started several hours ago. On exam, the right testicle is swollen, and there's no, I always jack this word up, cremasteric reflex on the right side. When the examiner performs Prinzine, the patient experiences increased pain. Which of the following is the most likely diagnosis? Is it A, epididymmitis, B, testicular torsion, C, varicose, or D, acute prostatitis? Take a moment and tell me what you got. All right, so stem of the question here states which of the following is the most likely diagnosis. So again, when we're looking for the diagnosis, run it back and look at these assessment findings. So we have this 19-year-old male. He's come in with sudden severe scrotal pain, nausea, and vomiting, and this all started several hours ago. Now, already you can put that in a category because this is sudden and this just started happening recently, right? That's already a tier to keep in your mind, right? Then on exam, the right testicle is swollen and there is no cremasteric reflex, all right, on that right side. So it's absent. So this is something else that is another tier under the testicular torsion because the cremasteric reflex, when it's absent, it is known to be I should say it's common to be associated with testicular torsion, but there's other potential things like an inguinal hernia that can cause this as well. So they always say that this is, we don't utilize it a lot because of the variables of it being other things. But this was also confirmed because the examiner went ahead and performed the Prinzine, excuse me, the Prinzine as well. So in this case, the Prinzine is negative, right? Because when the Prinzine was performed, the patient experienced increased pain. So that is the third confirmation for testicular torsion. Because remember, Brittany's Brilliance, a negative, starting with an N, negative, Prinzine, and the N in testicular torsion. I tell you to remember it that way, that the negative Prinzine is testicular torsion, whereas a positive Prinzine is epididmytis, and epididmytis has the letter P in it. So anyway, let's run this back down because I know I just said a bunch of stuff. This patient came in, he had these sudden symptoms. Testicular torsion is usually sudden and it's emergent, right? And what's happening is the spermatic cord is twisted. So their blood flow is reduced. This is why they're having so much pain. This is why the Prinzine is negative, because no matter whether you lift the testicles or not, they're not getting relief from this. They may, just like in this scenario, have increased pain. Whereas epididymmitis is the inflammation of the epididymis. So when the epididymis is inflamed, when we are lifting the testicles, that's giving relief because it's taking pressure off of the epididymis. The epididymis is tender and inflamed. Epididymmitis, itis meaning inflammation, right? So that's why the Prinzine is positive for epididymmitis. But anyway, again, sudden was something for you to pay attention to. Again, this is emergent. You want to refer them out immediately so that there's not necrosis. Also, the cremasteric reflex was absent, and then the Prinzine was positive. So these are all things that would show you, the Prinzine was negative, I'm sorry, but all of these would show you that this is confirmation of a diagnosis of testicular torsion. So B is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number 1, at gmail.com. All of the things that I do offer are linked in the bio of this channel, including my website. But if you're looking to book any of my one-on-one sessions or any of the custom packages, I always say either call, text, or email, as I prefer to speak with you to gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.